Hi, good morning, you guys. It's Scott Fisher with the Pastors Group and Options for Senior Living. As you know, back in 2009, 2010, a group of us who had been working together at the Area Agency on Aging in one of their MEPA programs. MEPA stands for the Maricopa Elder Abuse Prevention Alliance. That program had a public policy and advocacy subcommittee that I was a part of, and it was identified at that time that a movement had to be initiated to address the and with the motivation to protect our seniors that were vulnerable and being exploited by people who engaged in this business of referral and placement. And so Passers, the beginnings of Passers was formed as a response to a public need. And so 2012, we formed and organized with our bylaws that were adopted, and now almost 6 years later, I'm still sitting as the president of this group. Our membership has grown to over 35 agencies that are involved and over 200 affiliate members. And the importance of Passers is that as a voluntary request, agencies have been invited to join us and unify under a set of best practices that establishes a code of ethics and a professional behavior that unites us all. And it's acceptable to our partners, it's acceptable to our community, our healthcare system. And we've been, I believe, successful to this point. You guys, last week, under just prior to our board meeting on Thursday, I was notified that there was a bill introduced into our House of Representatives here in Arizona that the bill number is HB 2333, that in effect, and whether this is the intended or the unintended effect of the language of this bill, but it would in effect, if you interpret it the way we are interpreting it right now, is that it would make our industry a felony, and accepting referral fees from healthcare facilities or healthcare providers, or for a healthcare provider or healthcare facility to pay a commission or referral fee, would also be a felony. And there's various classes defined in the bill. And so with this very vague language, and we're not really sure what the intention of the sponsors of this piece of legislation completely is, we are organizing and we are pulling our hands, trying to put our hands around the whole thing. And as this nonprofit trade association with our 501c6 designation, our charge and our mission is to educate and advocate for the interests of our community, and that it would even involve, or at times potentially involve, us in legislative action or legislative influence. And so it's that time. A number of you have joined. I mentioned that earlier. There's 35 agencies already part of what we do, and for this, we need you now more than ever. And so we're going to be reaching out to you, keeping you in the loop. And this is to protect your interest in your business. This could literally put us all out of business. But for those of you that get this and you're not a member yet, it's time to get involved. It's time to say, I don't understand, or I'm not sure what you guys are doing or up to. This is the first thing that we were organized for, and that's to protect the interests of our industry. And so if you've not had a chance to meet me or get an understanding of what our mission is, this is the time to organize and unify. Your business is at stake. Our future is at stake. I'm not trying to be melodramatic. I'm not overblowing this. If you read this, it would concern you as well. And so we'll be sending out the link. We're going to be asking for involvement, signature, support, and membership. And we can get this thing straightened out. We can help the sponsors of the bill write it in such a way that it would clarify who their intended target is, so it would exclude us, or write it with definitions with exclusions. There's lots of ways to go about this, and there's lots of us that are involved in this. The healthcare system, the extended healthcare system, the assisted living industry is all really, in the last 15 years, become dependent on us to do what we do, and we serve a great role in the community. So as your president, I'm asking you to get involved. You can come to Passers. .org, that's PASRS.org. You can register and get more information there. Our office phone number is 602-845-1300. Also, you can email us at admin@passers.org. And finally, you guys, on February 22nd at 9 a.m., our monthly Passers meeting, and we were planning on doing a State of the Union of the organization anyways, and so here we go. We're going into the deep end of the pool already, first part of the year. But on February 22nd, 9 a.m. at our partners Morningstar of Phoenix, you can be there at that meeting, and we would hope that you would make it a priority, put it on your calendar now, and join us and be there. We'll go through what we've learned at that point. We'll keep you posted. We'll get this out. And for those of you that are going to receive this on the first go round, we would so appreciate if you would share, hit, and send to the people on your spheres of influence. If you are an assisted living center or home and you regularly communicate with a list of referral agents and placement specialists, please make sure they get this and pass this along and implore to them the importance of this. All of our businesses are hinging on keeping this industry alive and well and vibrant. So I thank you for your time. If you have any questions, you can reach me also at optionsforseniorliving.com. My email address is scott@optionsfsl.com. Thanks and have a great afternoon. We'll be in touch.